Good health is a journey, not a destination. Good evening, dear friends. We are back with yet another episode of BMC Global Live Alhilal Health World, nothing but lifestyle. In each episode of this talk show, we bring before you an expert doctor from Alhilal Hospital to address your various health-related queries and concerns. Today, we would be discussing about root canal treatment, and we are delighted to have with us Dr. Sarun Thomas from Alhilal Hospital, Muhharaq. He is a specialist endodontist with an experience of more than 12 years, and let's welcome doctor to the show. So, doctor, welcome to the show.
Thank you, and I'm happy that you have invited me to the show.
It's a pleasure, doctor. So, doctor, you are an endodontist. So, what does an endodontist specialize in?
See, endodontists are specialist dentists who focus on diagnosing and treating complex cases of tooth pain. So, what an endodontist usually does is he does treatments like root canals and other procedures to relieve the pain of the patient. We usually work to preserve the natural teeth.
So, doctor, when a patient comes to you,
Yes.
how do you decide that he needs root canal treatment?
Okay, see, there are certain indications or signs which suggest that the patient requires root canal treatment. First thing is that if the patient has severe pain which does not subside without taking any medicine, or if the patient has pain while chewing food or applying pressure on the teeth, or some patients even complain that they get up in the night from sleep with severe pain. Yeah, so a pain while lying down position, then certain types of discolorations or some swellings on your jaw or near the tooth might indicate that you need a root canal treatment.
So, doctor, can you now explain the different steps involved in root canal treatment?
Yeah, sure. See, most of you are aware that our tooth is made up of different layers, and the innermost layer of the tooth has something called the pulp tissue. These pulp tissues are the vital part of our tooth, and usually when you have some abscess or infections or deep caries, these pulp tissues get infected. And during a root canal, what we do is that we try to gain an access into the pulp chamber. And once we do that, we remove the infected pulp tissue first. And after we remove that, we try to clean that area where the pulp tissue was present, and that is called the root canal space. And when we clean it, we have to first measure the length of the tooth. The root, because different tooths have different root lengths. So we measure the length of the root with radiographs or with some certain instruments called apex locators. And once we measure that, we thoroughly clean the root canal space, and then we try to disinfect. So disinfection is a major part of root canal treatment. And once we disinfect the root canal space, we fill it with the filling materials which are used to fill the root canal space. And after this, there is something called the post-endodontic treatment, in which we recommend crowns or certain types of fillings.
So, doctor, how many sessions are needed normally for this root canal treatment?
It depends on case to case. Some cases, we can do the root canal treatment in a single sittings, which might take around 30 minutes or to 45 minutes. And there are some cases where the tooth is badly infected or there is an abscess. In such cases, we will go for multiple sittings.
Doctor, another common query is the treatment painful?
That is a very common question which we get. So, what we do prior to root canal treatment is that we apply a local anesthetic. So, when we apply anesthesia, the tooth which is going to be treated gets numb. And once your tooth is numb, you might not feel much pain. You might feel some pressure from the drills or the instruments we use. And one more thing which I like to add to this is that, most of the times when the patient comes to us, they have a phobia. They have very high anxiety. And studies show that higher your anxiety, the chances of you to get numb is less. So, before we do any treatments, any dental treatments, we talk to the patient, we try to make them comfortable, and we take time to explain the procedure to them and make them relaxed, and then we try to do the treatment.
You mentioned about the crown.
Yes.
Is it necessary to put the crown, or can we leave the tooth as such?
See, usually the patient comes for a treatment when their condition is really bad. Otherwise, all of us try to avoid meeting the dentist. So once they come, if the tooth is severely damaged or the tooth is usually in a pretty bad condition. So once we do the treatment, what we do is that we try to remove the decayed or the infected portion of the tooth. And once all these infected tissues and decay is removed, the teeth might be more delicate, it might be weak, or it is prone to fracture. So in that case, we always recommend in doing a crown to reinforce the tooth.
So doctor, is there any other alternative for the crown?
Crowns and certain other types of fillings are preferred post-endodontically. So if you ask me about the back teeth, the posterior tooth, we have some kind of fillings called onlays. So onlays can be considered in posterior region, but we have to keep in mind that you should have a pretty healthy amount of tooth structure left behind after the root canal treatment. So if the tooth structure left behind is strong, then onlays can be preferred over crown.
So doctor, which is the best option, the root canal treatment or tooth extraction? What is your suggestion?
I always tell my patients that we have to give priority in saving our natural teeth. So once we extract the teeth, we have to replace it with an implant or some kind of bridges, which is more expensive and more time consuming. So, always nothing comes close to our natural teeth. So, it's better that we preserve our natural teeth.
And finally, doctor, what is your message to our viewers regarding oral hygiene?
It's pretty simple and clear. Brush your teeth twice daily, do a flossing. And the next thing is also very important, which every dentist tell to their patient, to visit them or consult a dentist every 6 months. So what happens when you visit your dentist every 6 months is that we will be able to catch the decays or other problems at an early stage. So when we catch these problems at an early stage, we will be able to do a simple fillings and treatments so that you can avoid expensive root canal treatments and crowns.
So thank you, doctor. Thank you for joining us today. Thank you once again.
Thank you so much for welcoming me to the show.
So viewers, if you are ever in need of root canal treatment, go for it without hesitation and preserve your natural tooth. Thank you for watching and tuning to BMC Global Live Al-HILAL Health World every Tuesdays at 8 p.m. Till we meet again next time, this is Jessila Mujib signing off. Good night.